आप सुन रहे हैं एबीसी रेडियो WWTR 1170 AM ब्रिज वाटर, आपकी चॉइस।
एबीसी रेडियो आपकी चॉइस 1170 AM।
जी हाँ, ईबीसी ले लो मजा। और ईबीसी पे आज मैं आ गई हूँ। मैं आई कहाँ से हूँ ये एक्चुअली पता करेंगे अभी कि मैं कहाँ से आई हूँ, बट इट्स फॉर अ वेरी स्पेशल सेगमेंट. दिस इज अ सेगमेंट विच वी ऑल लुक फॉरवर्ड टू बिकॉज इट्स इंफॉर्मेटिव. It is also a very, very important educational segment brought to you within partnership of Rutgers Cancer Institute of New Jersey and RWJ Barnabas Health. You can actually log into their sites rwjbh.org/beatcancer. And what are we going to talk and who are we going to talk with? Dr. MD Eshan Patel is a hematologist and oncologist in the Lung Thoracic and Oncology program at Rutgers Cancer Institute of New Jersey and RWJ Barnabas Health and director of the Lung Cancer Screening Program at Robert Wood Johnson University Hospital, Somerset. Dr. Patel's clinical expertise includes cancers of the lung and thymus, mesothelioma, and head and neck cancers. He provides his patients access to top-notch oncology care, enrolling many of them into clinical trials to receive novel therapies. He has also contributed to research in various cancers in understanding molecular biology, driver mutations, precision medicine, and optimizing and integrating immunotherapy approaches. So with all these super strong credentials, it is a pleasure and an honor to invite on EBC Radio Dr. Eshan Patel. Doctor, it's a pleasure to have you on air. Thank you so much for educating our listeners and being on EBC Radio.
All right. Good afternoon, everyone. Thank you for having me.
So as I was telling our listeners that you have all these strong credentials in the world of cancer, which is, wo naam sunte hi everybody gets very scared. So we have few questions for you, doctor. So for the first one is, what are the different types of lung cancer?
Right. So lung cancer, there are three main categories. The first category is a small cell, and the second category is non-small cell lung cancer, which is divided further into squamous cell and adenocarcinoma. Small cell and squamous cell cancers are usually related to smoking. Adenocarcinoma can also be due to smoking, but is very most commonly seen cancer in a non-smoker. This is a cancer that arises from the glands in the lung. And of course, there are other cancer that has spread to the lung, which we call metastasized to the lung, but they are not primary lung cancer. Those are basically came from some other area in the body.
Okay, so that's very, very, I think it's a good information because we know there's so many smokers out there, so people need to make a note of this. The other is, people, how do people know, like what kind of symptoms are there for lung cancer for people to make a note of that?
Right, so, and I just want to emphasize that there is adenocarcinoma, there is a type that also can happen in non-smokers. So, of course, lung cancer we always associate with smoking, but there are non-smoking related lung cancers also that we need to keep in mind. What are some of the symptoms? Of course, coughing that continues to get worse. When you have viral syndromes and you get cough, which lingers for 2-4 weeks and go away, that's fine. But something that has been going on for beyond 4 to 6 weeks, that's not getting better. Chest pain or chest tightness, shortness of breath, especially when you're walking around in the house or going up the stairs, wheezing, coughing up blood, that's never a good sign. Fatigue, tiredness, that's not common for you and that's persistently getting worse. And weight loss, which is one of the biggest signs that everybody should be careful of. Unintentional weight loss, when you're not trying to lose weight but you're shedding like 10-15 pounds a month, that's a very big sign and you should get medical attention right away.
So Dr. Patel, is our South Asian community more prone to lung cancer?
Yes, especially the adenocarcinoma, which is very commonly seen in Asian females, especially non-smoker. And then whoever are born in India, those South Asians have higher rate of non-small cell lung cancer compared to South Asians who were born in America. And I think that's because of the environmental exposure to different things. South Asians have remarkably low rate of non-small cell lung cancer compared to other races out there. But still, you always, especially smoker population, should be always on a vigilant about the screening.
So now let's talk a little bit about the screening part, right? So what should people know about it? Like who's eligible? How often should they be screened? Questions like that.
Right. So screening, usually we recommend screening for patients who are between age 50 to 80 who have a 20-pack year history of smoking. When I say pack year, means you just whatever amount of pack you smoke per day, you times that by the year. So if you pack 2 pack a day times 10 years, that's 20-pack year history. And if you're a current smoker or former smoker, and if you have quit within past 15 years, you qualified for lung cancer screening.
Is it a special request that people need to go to their doctor and request? Because I don't think this is part of the normal screening, right, after 50?
So it should be, actually. There is a big push to for physicians to think about lung cancer screening also, right? We do very good job with the colon cancer screening and breast cancer screening, but we sometimes oversee and forget about the lung cancer screening. So especially if you're a smoker, always bring it to your primary care doctor's attention, and we are also trying to do a lot of education around that to have more patients get screened for lung cancer. Currently, unfortunately, is only available for patients who are either current smoker or former smoker, and in the future, hopefully that changes.
Okay. And what is the treatment like for lung cancer?
So treatment for lung cancer, it depends on what stages lung cancer is in. If we detect it early, so stage 1 can be just surgery and is curative just by doing surgery. Stage 2 and 3, we can do multi-therapy approach that might require surgery followed by chemo plus and minus radiation. So it can be multiple different approach to cure from stage 2 or 3 lung cancer. Stage 4, which is the last stage when cancer spreads outside the lung, that basically we treat mostly with systemic chemotherapy or immunotherapy. Nowadays, we have a lot of new agents such as targeted precision medicine. So we have a more targeted agents, immunotherapy for patients for stage 4.
Okay, so now when we talk about special care, right, what are the benefits that National Cancer Institute designated comprehensive cancer center like Rutgers Cancer Institute and RWJ Barnabas Health provide?
Right, so there is multiple benefit and advantage when you go to comprehensive cancer center. First, what we have here is a multidisciplinary team approach. What that means is we have all the specialists under one roof: oncology surgeons, radiation oncologists, medical oncologists like myself, pulmonary doctor. So we all is a team approach. We see the patient as a whole. We discuss what's the best thing for that patient. We take account in every aspect of patient's care and then make a best decision for that patient. It is also outside the medical team. We also have other teams to help patient through the journey of cancer, such as they need dietitian, behavioral health experts, social workers. All those are available to them at the Comprehensive Cancer Center. And the most important part is the clinical trial. When you have nationally designated Cancer Institute, what you can benefit is from the clinical trials. Those are new cutting-edge technologies, new targeted agents and precision medicine, such as immunotherapy and targeted agent that you can get under clinical trials for better outcome.
Okay, so I think that clinical trial part is very important to be stressed because I think there's people who benefit a lot from that research. A very, very important question, doctor, before we let you go. How can people reduce the risk of lung cancer?
So smoking is the most major cause. So if you are a smoker, quit smoking right away. There are a lot of different ways, and talk to your primary care doctor. There is New Jersey help quit smoking centers, which can help you. There is a design program. So stopping smoking is the most number one major thing you can do to reduce your risk of lung cancer. Now, other things such as occupational exposure. So if you're working in a construction business, or if you're working in the factories or somewhere there is an occupational exposure, always have a mask on. Make sure you are fitted regularly and you're not exposed to those hazards. Diet, healthy lifestyle, that's always important. Eating healthy, good sleep patterns, those are things that are always good to reduce your risk of any cancer, per se.
And I think we can add one more thing, good luck, right?
Good luck, yes, of course.
All right. Thank you so much, Dr. Eshan Patel. It was a pleasure talking to you. Very, very informative, and we'll look forward to talking to you again soon. Thank you.
Thank you so much for having me.
Thank you. Well, listeners, we were talking to MD Eshan Patel, a hematologist and oncologist with Rutgers Cancer Institute of New Jersey. And this segment was brought to you in partnership with Rutgers Cancer Institute of New Jersey and RWJ Barnabas. You can visit them at rwjbh.org/beatcancer. Thank you so much, everyone, for listening.